The overall mental health and well-being of children of service members is often swept under the rug when their parent or guardian returns from an overseas deployment. Long-term separation between a child and their parent can result in negative behavioral, emotional, and mental development as they grow into teenagers and young adults. Toddlers, especially when starting school, can be vulnerable to behavioral issues, anger issues, and inclined anxiety levels while in both school and at home. These subconscious reactions have been reported to increase in older children when exposed to prolonged separation to their parent or guardian. North Babylon, New York has been no stranger to service members and their families, given that many of these families heavily rely on the Northport VA Medical Center for providing treatment for veterans, ranging from prescription medicine, recommending other treatment options like surgery and physical therapy, and other treatment programs in which they aid the recovery process of becoming accustomed back into civilian life. With over 17,000 citizens living in North Babylon today, less than 1% are reliant on the health care provided by the VA. In North Babylon, the population of students with either parent directly affiliated with the military is very low. Because of this, counseling or extra guidance in school with professionals that know how to approach the familial traumas they may encounter growing up is extremely difficult and hard to find. The Northport VA Medical Center often recommends families of service members to take advantage of therapy services at the Babylon Vet Center, where professional therapists are trained to work specifically with military families. Children of veterans can take advantage of this resource after experiencing traumatic events within the household, like marital abuse and witnessing substance abuse. Marital abuse among military spouses can be especially traumatizing for a developing child or young teenager, considering that marital abuse between military spouses are 1. More likely to occur, and 2. Can subject their children to negative coping strategies to stress when they reach adulthood. Children who are of preschool or kindergarten age who are exposed to abusive behavior between their parents are more likely to become hypersensitive to loud noises, become well-developed and showing their emotions that mirror their parents' abusive behavior, and learn that this abusive behavior and victimization are associated with certain genders. Older children who are subjected to marital abuse at home are more vulnerable to learn that it's okay to pursue toxic relationships, decline in academic success and interest, and develop an inability or decline of learning and retaining new information. Because service members face stressors at a higher and more often rate than their civilian counterparts, they are more likely to fall into the habit of substance abuse to ease their stresses and fears. Not only is substance abuse an ongoing epidemic among our nation's servicemen and women, binge drinking disorders are also very present. The rates at which service members abuse alcohol has risen dramatically within the last decade in order to reduce their stress. Mental disorders like post-traumatic stress disorders or PTSD and depression are correlated to deepening addictive behaviors in those who have served overseas. Children of service members who are struggling with substance abuse and alcohol abuse are often at the receiving end of when the decisions and behaviors of their parents are impaired. In reaction to being subjected to their parents' dramatically changed behavior, children can present a variety of different behavioral, mental, and emotional changes, such as feeling scared, helpless, feel guilt about themselves, be mean to others, and be considered the quote-unquote parental friend of their peer group. Because children of active duty servicemen who have addictive behaviors, they are more likely to witness marital abuse, be physically or sexually abused, along with follow in their parents' behavior and use drugs and or alcohol as a coping mechanism for when they face adversities in their teen and adult years.